Hi, my name is Caitlin. I'm going to be doing a newborn assessment. Before I go in the patient's room, I'm going to check the patient chart for the birth history. I'm going to look at the APGAR score. This baby's APGAR score was 9 out of 9, which is perfect. I'm also going to look at any pertinent information about the labor, birth, postpartum, and pregnancy. Now I'm going to go in the patient's room. Hi, my name is Caitlin. I'm going to be your nurse today. Is it okay if I do a newborn assessment on your baby? Okay. I'm going to close the curtain, provide privacy, wash my hands, and put gloves on. Now I'm going to assess vital signs. I'm going to do temperature, pulse, and respirations. The normal range for temperature is 97.7 to 99.5, and you're going to assess that under the axilla. I'm also going to assess pulse. The normal range for pulse is 110 to 160 beats per minute. I am going to listen to the apical pulse for 60 seconds. To do that, I'm going to listen immediately between the nipples. And for respirations, I'm going to place my hand on the baby's belly, and I'm going to count raises in the chest for 60 seconds. Each raise is one breath. After that, I'm going to measure height, weight, head, and chest circumference. For height, you measure top of the head, tips of the toes. For weight, I would do that on a scale. For head circumference, you measure above the eyebrows around the whole head. For chest circumference, you measure above the nipples around the whole chest. After that, I'm going to do a general assessment. I'm going to look at the baby. For body alignment, I'm going to make sure that the baby's body is symmetrical bilaterally. So it has 2 arms, 2 hands, 2 feet, 2 toes, sorry, not 2 toes, 2 legs, 2 ears, 2 eyes. I'm also going to, I could also at this time notice a cleft palate. Next I'm going to do body symmetry. For this, you're looking for equal movement bilaterally. Is the baby moving its arms on both sides the same amount? Can it flex the same amount? Extend the same amount, arms and legs. Also, you want to look for equal movement bilaterally on the face. After body symmetry, I'm going to do muscle tone. For muscle tone, you look for flexion in the arms and the legs. That is a sign of good muscle tone. If you look at this baby, its arms and legs are not flexed, so that would be a sign of poor muscle tone. After that, you're going to do cry. Most likely the baby will cry at some point during the assessment, so that would be the time to assess that. I'm also going to do skin. I'm going to look at vernix caseosa. Vernix caseosa is a white cheese-like substance on the baby's body. Depending on the gestation that the baby was born at, as well as if the baby has been bathed or not yet, you might not find any, but you're going to look in the creases of the arms and the legs and in any skin folds. I'm also going to look for milia. Milia are white bumps, most commonly found on the nose. Those are normal. I'm also going to look for lanugo hair, or baby hair, on the back and on the arms. Most commonly is where it's found. This baby does not have any though. I'm also going to look for erythema toxicum. Erythema toxicum is red blotches on the baby's body. I'm going to look in the front and the back. This baby does not have any. I'm also going to look for Mongolian spots. Mongolian spots are purple bruise-like spots on the baby's body. I do not see any on this baby though. You're also going to look for petechiae. Petechiae are normal. They're red needle-like spots on the baby, most commonly found on the face. It's caused by breaks in the blood vessels during labor when it's passing through the birth canal. Next, I'm going to do the head. For the head, first I'm going to assess the fontanelles. The fontanelles, there are 2 that I'm going to assess, anterior and posterior. Anterior is easier to find, it's larger, it's a diamond. The posterior is sometimes harder to find, it's a triangle and it's smaller. I'm going to palpate both, and I'm going to feel for if it's sunken in or bulging. I'm also going to look at the baby's head and see if, look for signs of molding. If there was molding, it would be elongated. This baby does not have signs of molding. The head is not elongated. I'm also going to look for cephalhematoma. I'm going to look in the front and the back. So cephalhematoma is a bulge in the baby's head. This baby does not have one. I'm also going to look for caput saccadium. That is swelling across the scalp. This baby does not have that either. Okay, so next I'm going to look at face symmetry. This baby's face is symmetrical bilaterally, and there is no sign of a cleft palate. You can also, not cleft palate, cleft lip. You can also look for that now as well. After face symmetry, I'm going to start on the eyes. I'm going to look at the eye color. This baby's eyes are brown. Most commonly, they'll be gray. I'm doing this assessment about 12 hours after birth. So yeah, most commonly the eyes would be gray at this point. I'm going to assess the pupils. I'm going to take a pen light and shine it in the baby's eyes. The pupils should be equal in size, round. It's normal for them to be sluggishly accommodating to light, and it's not accommodating. It's normal for them to be sluggishly reactive to light, and it's normal for them not to be accommodating to light. After I do that, I'm going to look for signs of strabismus. Strabismus would be a lazy eye. This baby does not have a lazy eye. I'm also going to look for signs of conjunctivitis in the conjunctiva. This baby does not have those signs though. Its conjunctiva are light pink and moist. After that, I'm going to look at the ears. For the ears, I'm going to look at, see if they're well formed. This baby's ears are well formed. I'm also going to look if they're aligned with the outer corner of the eye, which they are, both sides. Eyes, ears, nose. Next, I'm going to do the nose. I'm going to assess nose patency. To do that, I'm going to cover the mouth and cover one nostril and feel for airflow out of the other nostril. I'm going to do the same thing on the other side. This baby's nose is patent on both sides, patent equally bilaterally. I'm also going to assess the mouth. I'm going to take my pinky, move it around, all around the inside of the mouth. I am feeling for signs of a cleft palate, which would feel like holes, and also for Epstein's pearls. This baby does not have either of those. During the mouth assessment, you can also assess suck and swallow. I would most likely do that. I would watch the mom. I would watch the baby while it's breastfeeding and make sure it can do those. After that, I'm going to assess the neck and the clavicles. It's normal for the baby to look like it does not have much of a neck. I'm going to palpate the neck and the clavicles. The clavicles should not have any holes, and they should be symmetric. I'm also going to move the baby's arms around, and if I hear cracking, that's a sign of crepitus. Next, I'm going to do the chest. First, I'm going to look at the chest. The chest should appear cylindrical, it should be symmetric on both sides, and it should rise equally bilaterally. I'm also going to look at the nipples. First thing I'm going to do is size. I'm going to take my fingers, place one on each side of the nipple, and I'm going to measure the distance between my fingers for nipple size. I'm also looking for signs of engorgement. No signs of engorgement here. And I'm also looking for an extra nipple. This baby does not have an extra nipple. Next, I'm going to auscultate breath sounds. Before I do that, I'm going to listen with my ears for grunting. I do not hear any. I'm going to auscultate breath sounds above or below both nipples. If I hear crackles, that is normal, because this baby is 12 hours old. After that, you can assess apical rate. I already did that when I assessed pulse. I also already assessed murmur when I was assessing for. I also assessed for a murmur when I was assessing the pulse. After that, I'm going to move down to the abdomen. I'm looking for signs of distension. I would take the diaper off at this point. It's easier to assess the abdomen. Sometimes diapers go up high. I'm looking for signs of distension. I'm going to look at the cord. The cord should have 2 arteries, 1 vein. After that, I'm going to listen to bowel sounds. The baby should have bowel sounds around an hour after birth. I'm also going to assess elimination patterns. I'm going to either check the diaper or ask the parents about voiding and any bowel movements. If the baby has had a bowel movement, I'm going to either look at it or ask the parents if it's meconium, and I'll explain what meconium is. It's a black tar-like stool. After that, I'm going to move to genitals. Genitals for a female, you're assessing for discharge. You're also assessing that the labia cover the clitoris. For a male, you're assessing the location of the meatus. It should be at the tip of the penis. You're also going to palpate the testes and make sure they're in the sacral sac. You're also going to look for rugae on the testes. For both a male and female, you're going to ask about or look at the diaper to assess voiding patterns. Since this is within the first day of life, the baby should have one wet diaper. After that, I'm going to assess extremities. For the extremities, I'm going to assess that there's equal movement bilaterally. I'm going to move these arms and legs around, make sure that they both move the same amount. After that, I'm going to assess muscle tone. For muscle tone, I'm going to pick the baby up. The baby should stay in a flexed position. This baby is in a floppy position, so this is an indicator of poor muscle tone. If it was flexed, it would be a sign of good muscle tone. After muscle tone, I'm going to count fingers and toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, this baby has all of its fingers and toes, no extras, no missing. After that, I'm going to assess range of motion. First, I'm going to look at position. The arms and legs should be in a flexed position. This baby's aren't. That could be a sign that it's premature. But what else? I'm going to assess the square window. I'm going to do the square window test. To do that, I'm going to bend the palm down to the wrist unless I feel resistance. A full-term baby should be able to get its palm against its wrist. I'm going to do that on both sides. After that, I'm going to do arm recoil. The arm recoil test, what you're going to do is you're going to bend the baby's arms up, hold it like that for 5 seconds, straighten the arms out at the sides, let go, and you're going to measure the amount of flexion that the baby's arms go back into. So I'm going to do that. Okay, so next I'm going to do the popliteal angle. For that, you bend the baby's leg. You do this on both sides. You bend the baby's leg and try to straighten the leg out until you feel resistance. And then you measure the angle that the leg is at. You're bending the baby's leg against the abdomen during this. Okay, so next I'm going to assess the scarf sign. For the scarf sign, you keep the baby's shoulder against the bed, bend the arm across the chest. Then you measure the location of the elbow in correspondence to the midline of the body. Same thing, I'm going to do that on the other side. Okay, after scarf sign, I'm going to assess heel to ear. For heel to ear, you bend the baby's leg up. You lift the baby's foot up towards the ear. And you measure the angle as well as the location of the foot in relation to the ear. And I'm going to do that on both sides. Okay, after that, I'm going to measure for hip dislocation. Assess for it. For hip dislocation, what you do is you bend the baby's leg up and out, and you listen for cracks. If you hear cracks, that is a sign of hip dislocation. After that, I'm going to look at the feet and look for clubbing and foot position. After that, I'm going to do the spine. For the spine, you palpate down the whole spine and you feel for holes. I'm also going to assess anal patency. To do that, I'm going to swipe my finger across the anus and look for muscle contractions. And that, if there are muscle contractions, that is a sign that the anus is patent. After that, I'm going to do reflexes. For reflexes, first one I'm going to do is Moro. That is the startle reflex. What you do is you pick the baby up, kind of act like you're going to drop it, and if the baby's arms go up, the baby's arms should go up. That means they do have that reflex, because they'll kind of look startled. After more, I'm going to do tonic neck. For tonic neck, you turn the baby's head in one direction. The corresponding arm to that direction should go out, and the other arm should be bent, kind of at their side. And I'm going to do that on both sides. After tonic neck, I'm going to do the popliteal and the palmar reflex. Palmar, put your finger in the baby's fingers. The baby should grab your finger. Same thing, put your finger under the baby's toes. The baby should grab your toes. That's popliteal. Palmar is the hands. Okay, after that, I'm going to do rooting. For rooting, you brush across the baby's cheek. The baby should turn its head in the direction corresponding to the side that you brushed. And I'm going to do that on both sides. Okay, after that, I'm going to assess sucking and swallowing. Again, I would assess that while the baby is breastfeeding. After that, you're going to do the stepping reflex. Stepping reflex, you stand the baby up and the baby should take steps. After that, I'm going to do the Babinski reflex. The Babinski reflex, you swipe up and across the foot and the baby's toes should splay out. Up, across. Okay, good. This baby's toes did splay out on both sides. Next, I'm going to do the gallant reflex. For the gallant reflex, you swipe across the baby's spine and the baby should curve that direction. Okay, so after reflexes, I'm going to assess the behavioral state. For behavioral state, the options are deep sleep, light sleep, drowsy, quiet alert, active alert, and intensely crying. This baby would be considered active alert because it's not crying and it does not look sleepy. Its eyes are wide open, but it's not crying. Okay, so that is the end of my assessment. So I'm going to put a diaper on the baby, get it dressed, and give the baby back to mom to promote bonding. Thank you.